Hello everyone, I am Dr. Dana. I am a board certified family practice physician, mother of 4, daily yogi, dog lover, certified personal trainer, and health advocate. Let's talk about cannabis hyperemesis syndrome. Cannabis, marijuana. Hyperemesis means lots of vomiting. However, there can be a whole host of symptoms associated with this, including abdominal pain and cramping, diarrhea, fatigue, and just a general feeling of not feeling well. Typically, people that get cannabis hyperemesis syndrome are chronic cannabis users. However, it really can occur at any given time, and you may have used cannabis or marijuana for many, many years and then develop the syndrome randomly. Did you know that one study found that up to 6% of people who visited the emergency room for vomiting actually had cannabis hyperemesis syndrome? I guess it depends on what state you live in. So what causes this syndrome? We don't know. Let's just be honest. We don't know. If somebody tries to tell you they know, or a doctor tries to tell you they know, they're lying. There are 3 phases of cannabis hyperemesis syndrome. The prodromal phase involves some morning nausea, not really feeling well, maybe fearing that you're going to throw up, but not actually throwing up. The second phase is the hyperemetic phase, and this is going to be about 24 to 48 hours of repeated vomiting. Probably getting in a warm shower or bath is going to make you feel better, and you're going to be avoiding certain foods. The third phase is defined as the recovery phase, and this is when you stop using cannabis and then your symptoms slowly start to get better. Of note, it may take days to months for your symptoms to get better once you stop cannabis use altogether. The good news is most people feel better within 10 days of ceasing cannabis use altogether. If left untreated, you could become severely dehydrated or develop chronic inflammation of your esophagus or even tear your esophagus, so please don't do this. And while the cure involves stopping cannabis use altogether, there are some medications that we can give you along the way to make you feel a little bit more comfortable, including IV fluids. So while I was one of the first medical marijuana providers in the state of Pennsylvania, I do not believe that cannabis is evil, and I think that there are certain uses for it, but cannabis hyperemesis syndrome is indeed happening, and it's something to be aware of if you are a regular cannabis user, even up to 2 or 3 times a week, and are having these symptoms of abdominal pain, nausea, and vomiting. And guys, as always, remember, that guy that gave you the finger in the car the other day driving by, he's probably either super stressed out because of the holidays or because of COVID or something else. So give him a break and spread kindness, not hatred.